My name is Megan Heffernan, and I am a senior research scientist at NORC at the University of Chicago. I'm really excited to be here today talking to you about NORC's Rural Health Mapping tool. So just to start, local data are critical for decision makers, particularly in rural communities. With funding from the CDC, NORC and East Tennessee State University, ETSU, developed the Rural Health Mapping tool, which is available at ruralhealthmap.norc.org. You'll see that link on the bottom of your screen. The Rural Health Mapping tool includes county-level data on COVID-19, including COVID-19 cases, hospitalizations, deaths, and vaccination, the Prosperity Index, which I'll describe, leading causes of death, sociodemographic factors, economic factors, physical environment, access to healthcare, food environment, and other health outcomes. Local data can be used to support local planning efforts, advocacy, proposal development, allocation of resources, understanding both assets and deficits in your community, and convening partners. So I'm going to show a few of the features on this main base map of the slide. What you'll see here is the base map that is showing the percent that has completed a primary series of the COVID-19 vaccination. If you go to the left-hand panel, you'll be able to see the other variables that you can place on the base map. So you'll see here causes of death is extended. So all of the top leading causes of death, you can add to the map to see that on the base map. You can also look at these COVID-19 outcomes. So as I mentioned, outcomes, vaccination, hospitalization, and the boosters. And then you also can create overlays, which I'll show on the next slide, but you can add overlays for all of these other causes of death. You can add them for sociodemographic, economic, physical environment factors, and so on. So this is what it looks like when you have an overlay of one of the overlay variables. So what we have here is heart disease mortality is the base map, and then we have median household income as the overlay. And you'll see here on the bottom right, the scatter plot. For any two variables on the map, you can actually show the correlation. So I'll zoom in here a bit. This shows you what the graph looks like. So again, it compares median household income and heart disease, and you can see the trend there. You can also look at any given county. So if you hover over one of the counties, it will show you the data points that you have selected for that given county. We also have a county fact sheet for every county in the United States. This county fact sheet provides data for all of the indicators in the tool, including comparisons to your state and to the United States as a whole. So what we have shown here is the causes of death tab, but you can see that you can also access all of the other data sources. So whether that is the COVID data, the other vaccination data, prosperity index, sociodemographic, economic, physical environment, access to healthcare, food environment, or health. And like I mentioned, you'll always see your data for your county and then your state and the United States as a whole. And lastly, I wanted to touch briefly on the Prosperity Index, which is included in this mapping tool. So the Prosperity Index provides data on the single numerical measure that reflects the prosperity of the county. And this is based on 16 indicators, which are included in this table here. And you can access all of the data for those indicators for your county. So you'll see here the example of Jackson County, Alabama. The Prosperity Index is broken up into 4 different components: economic risk, economic resilience, social risk, and social resilience. And you can see the 1 through 5 score, the 1 being the most prosperous and the 5 being the least prosperous for each of those measures. So this is just another variable that you can add as you're exploring the impacts of all of these health outcomes and indicators, and particularly in rural communities, how this impacts your community as you are planning and working towards achieving better outcomes for your communities. Thanks for the opportunity to present today.